Okay, about 90% of the clients that I see day in, day out come and see me purely because of back injuries, lower back injuries. So I see a lot of people who are, majority of my clients are sport-specific athletes, but I also see clients who are not non-sport specific, so clients who have incurred an injury for the lower back through maybe standing up quickly, lifting something incorrectly at work or at home, even if just a simple like trip on the ice, if it's frosty outside. I had a client who actually steps out of the car and slipped on the ice and put the back out, his lower back out, which is quite a simple mistake to do, but it's a very common area that I see it day in, day out. I just want to run through some exercises that I would do, and so if you're sitting at home now watching this on the internet, I would like to just take 5 minutes, just have a look at yourself in front of a mirror. I'm just going to talk you through some pointers so you can actually assess yourself at home, so how this can directly relate to you. Okay, 9 times out of 10, a back injury isn't necessarily caused through a specific impact. So, for example, falling over or picking up a box or something. Obviously, that's going to be one of a main cause of an injury. But years down the line, there could be certain postural indeficiencies or certain postural imbalances that you may possess that will actually accumulate into a back injury. So, one of the main areas of concern is your shoulders. Okay, so although obviously it's not relating to your back, it is actually interconnected into your back. So for example, if you're sitting down now watching this DVD or on the internet, and you're sitting there and your shoulders are forwards and you've got one shoulder higher than the other, so maybe you do a desk job and you're sitting at a desk all day using your right arm of the mouse, so your right shoulder is a lot lower than your left shoulder. Okay, if you're sitting there now and then you look yourself in the mirror and you've got your shoulders are protracted, so they're coming inwards, okay, so they're caving inwards, and you've got one shoulder higher than the other, this is creating an imbalance for your shoulders. Now this is obviously going to be connected down into your hips, therefore it's going to be connected into your knees and your ankles. So the whole of your body from ankle to toe is on the kinetic chain. So for example, if you've got your left shoulder higher than your right shoulder and both your shoulders are protracting and coming inwards, this is forcing the curvature in your upper spine. It's what we call a kyphosis. So this is directly going to have a link into your lower back. So basically, if you've got a curvature in the upper spine, it's also going to create a curvature in the lower spine. Now basically, the more curved your spine is, the more accumulation of pressure there's going to be. Everybody's spine is a slight S shape to it. Okay, no one's got a flat spine, but you want to try and get your spine as flat in position as possible to eliminate any kind of accumulation of pressure around the lower spine. So for example, if your shoulders are forwards and you've got one shoulder higher than the other, and a rotation, what we call rotation through the shoulder, this is going to cause the curvature in your upper spine, which therefore is going to curve in the lower spine. Okay, so the accumulation of pressure in your lower spine is going to be quite severe. So if you've actually started to feel, maybe you've got presently lower back problems and you're feeling pain and discomfort in your lower spine, just have a look at the alignment of your shoulders. So stand on front onto a mirror, and even stand on side onto a mirror, and have a look at the position of your shoulders. Are they coming forwards? If they are coming forwards, using this program that I'm doing online is a very simple exercises that I'll prescribe to you to actually retract your shoulders, pull your shoulders backwards, which therefore is going to flatten your upper spine, which therefore is going to flatten your lower spine, and getting rid of the accumulation of the pressure that's built up in your lower back. So it should hopefully alleviate any kind of pressure or a lot of discomfort you're going to be feeling in your lower back. If you have got a curvature in the lower spine, or what we call a posterior tilt through your pelvis, where in line terms of your pelvic alignment should be here, but if your pelvis is pushed backwards, so in other words if your backside sticks outwards, okay, this is what we call a posterior tilt. Now this is directly curved in the curvature in the lower spine as well. Okay, so just by using very simple exercises on this program that I run online, there's the postural correction program. Just by doing exercises such as hip thigh extensions, shelks, step ups, things like this, deadlifts. These kind of exercises are really going to be a very simple exercise that you can do at home or in the gym. That's going to alleviate any kind of discomfort that's going to be accumulating in the lower spine through having either a posterior tilt or protraction through your shoulders. Have a look through the program. Just take 5 minutes out and look at yourself in the mirror. Look from the front on, look from side on. Have a look at the alignment of your hips and your shoulders, and this should give you a very good indication of whether you're going to be experiencing back pain very soon. If you are, jump on board and we can sort you out straight away.